Shiny like a limousine.
Hello and welcome to High Viz Health. I'm your host, Dustin Udowich. No playing around today. We're going to get right to it. 10 risk factors associated with hypertension, high blood pressure. Let's jump right into it. Our first risk factor is age. Hypertension may be more common in men around the age of 45 as opposed to women, which start seeing an increase in high blood pressure around the age 65. Our second risk factor is race. For example, African Americans are at a higher risk for hypertension at younger ages than their white counterparts. Number 3, family history. Pretty straightforward here. High blood pressure may be inherited from family members. Number 4, weight. Blood pressure can increase if you're overweight or obese. Measuring by BMI between 25 and 30 would put you in the overweight category. Over 30 would have you labeled as obese. We want to get off those extra pounds so that we can lower our risk factors for high blood pressure. Number 5, activity level. The human body was made to move, and when we become stagnant, we run into a lot of health problems. If we're talking about the American Heart Association, they're going to recommend 150 minutes of moderate physical activity or 75 minutes of intense physical activity per week. The idea here, move, it's a sport of continuity, build activity into your day. This can be exercise, this could be gardening, this could be going for a walk. Figure out what works for you and move. Number 6, tobacco use. Chemicals in tobacco products are going to make the arteries narrow. That is going to push our blood pressure up. No good. Let's kick that habit and get on to some better health. Number 7, a high sodium diet. Eating foods high in sodium is going to cause the body to retain fluids, thus pushing that blood pressure up. Number 8 on this list, I decided to include consuming too little potassium. Potassium is awesome for offsetting the effects of sodium. The more potassium you eat, the more sodium you carry out in your urine. It also works to take some pressure off of our arterial walls, which helps in the end game of staying healthy. Number 9, consuming too much alcohol. Women should be around 1 drink per day, men 2 drinks per day. If we go way overboard with the alcohol, we are putting ourselves at much greater risk for hypertension. Number 10 on the list, I'm going to drop the S-bomb on you here, stress levels. Our blood pressure is going to elevate in stressful situations. We really need to be aware if we're suffering from chronic stress. That is going to have some long-range negative impact on our health, and we need to combat that as best we can. The big takeaway here, hypertension can have a massively negative impact on our overall health. It can lead to heart attack, stroke, vision loss, aneurysm, kidney dysfunction, and much, much more. So let's implement some really healthy and positive lifestyle so that we can steer clear of the health issues associated. All right, GSI family and beyond, thank you for listening. This has been Dustin Udowich with the High Viz Health Podcast, and we'll talk to you soon.